Hello, my name is Brandi Morinoue, and I'm the physician assistant here at the Center for New Medicine. I've been performing aesthetic procedures for the last 12 years now. We have a fully equipped aesthetic center and are working on many new and exciting changes to this portion of the clinic. We are now accepting online reservations for Botox and facials, and hopefully soon we will be expanding to be able to book more procedures online. We will also be offering membership packages with great discounts on many of our modalities if you book online. With the membership option, you can pay monthly, so you will not be stuck with a huge bill or have to save up to afford your usual beauty regimen. You can navigate to the cfn.com website to check out our spa. Today I wanted to answer some commonly asked questions about our two new devices, which are the Ultrashape and the Velashape. From what are these procedures to what are the results and kind of everything in between. So what is Velashape? It is a proven non-surgical solution that helps to contour the body, tighten the skin, decrease the appearance of cellulite, and reduce inches. It uses infrared light, radio frequency, massage rollers, and suctioning to achieve results. How does it work? With the infrared and radio frequency, it causes deep heating of the fat cells, the connective tissues, and the dermal collagen fibers to stimulate the growth of new and better collagen and elastin to reduce skin laxity and improve the skin structure and texture. What areas can be treated? So the typical areas treated are the arms, the legs, the buttocks, the flanks, the abdomen, the thighs. How many treatments are needed? Usually about 3 to 6 treatments, 2 weeks apart, will give the best results. And when will you see the results? You will see the results typically in about 4 to 6 weeks. So depending on the area being treated, you may see results after the first session within the first 1 to 2 weeks. And how long does the treatment last? So a typical treatment time for the Velashape ranges from between 30 and 60 minutes, depending on the area that we're treating. How much does the treatment cost? So the cost depends on the amount of surface area being treated and will range anywhere from $350 to $800. What are the cons to the treatment? So like most treatments, there is maintenance involved with the Velashape. So after the initial 3 to 6 treatments, we recommend that you come in for a single session every 6 months to maintain your results. And it's not a weight loss option, you will just lose inches. What are the side effects? There's usually just maybe a little bit of bruising, especially some pinpoint bruising, most commonly occurs. You may feel tenderness like you had a long exercise session the day after the procedure. Usually unlikely side effects include burning, scabbing, and blistering, but that's not really common. And how does it feel? It is mostly area dependent. Like on the abdomen, it usually feels like a warm massage, but on areas that are closer to bone, like above the knees or around the arms, it might feel more like a hot vacuum, though it's still tolerable. So what can you do to prepare for the treatment? There's no numbing needed since this procedure is minimal in pain. You do not want to really apply any creams like lotions, oils, or self-tanners to the skin areas that are going to be treated. You want to avoid blood thinners such as aspirin, NSAIDs around 2 to 3 days prior to the procedure to minimize the chances of the bruising. And we recommend hydration prior to the treatment with lots of water. Drink at least half your body weight in ounces. What can you do after the treatment to maximize the results? You want to continue with a good amount of hydration. You want to eat a healthy diet that's low in saturated fats, because the fat that we are going to be getting rid of is going to be cleared through the liver, so we don't want to put any extra pressure on the liver. You want to avoid alcohol for 3 days for the same reason, post-treatment, to allow for rapid clearing of the fat and toxins. Moderate exercise is recommended to increase the lymphatic drainage. So the second laser that we're going to talk about is the Ultrashape. So what is Ultrashape? Ultrashape is a painless, non-invasive, FDA cleared device which selectively and evenly destroys fat cells and is what we call a body contouring device. It will cause permanent fat loss in the area treated. How does it work? Ultrashape uses focused, pulsed ultrasound energy to destroy the fat cells. This device will destroy the walls of the fat in the form of and release it in the form of triglycerides, which are processed through the liver and eliminated from the body naturally. What areas can be treated? Typical areas treated are the arms, the legs, the buttocks, the flank, and abdomen, and virtually anywhere below the neck where unwanted excess fat is present. How many treatments are needed? Usually about 3 treatments, 2 weeks apart, will give the best results. And when will you see the results? You will typically see results within the first 2 weeks. But depending on the area being treated, the maximum results will be seen 12 weeks after the first treatment. How long can you expect to be in the office? So the typical treatment time ranges from 1 to 2 hours per area, depending on the amount of area being treated. If you decided to do 2 areas, like the flanks and the abdomen, then the treatment time will extend to about 2 to 3 hours. And how much does the treatment cost? So the cost depends on the amount of surface area being treated, and will range anywhere from $600 to $1,000 per treatment. What are the cons to the treatment? So this is not a treatment for severe skin laxity, cellulite, obesity, or weight loss. This device will not get rid of visceral fat, which is the fat like around the organs. It's only going to get rid of the subcutaneous fat, which is the fat that we can pinch in between our fingers. Before and after pictures are absolutely necessary. We like to take measurements before the procedure because you might not notice a huge difference since you see yourself every day, and while you may see immediate results with this treatment, sometimes it could take up to 3 months to see the optimal result, which means that this is a gradual improvement over a longer period of time. What are the pros to the treatment? So you will have permanent fat cell reduction with this treatment. It is painless. It will remove the stubborn fat that is difficult to remove with diet and exercise alone. You will see up to a 32% reduction in body circumference and improve your body shape with this procedure. On average, about 1.3 to 2.5 inches of reduction per area can be seen. So why choose this treatment over other non-surgical fat reduction options? You will have an even reduction of fat in the areas treated. You will not see an uneven amount of fat that is being lost in certain areas, and you will not see any bumpiness. There is no risk of hard fat deposits during forming above or below the area of the treatment. The Ultrashape can be used in smaller, harder to treat areas as well, and it will not cause any residual pain since it is not affecting blood vessels or nerves. What are the side effects? So there are virtually never any side effects with the Ultrashape. Unlikely side effects include burning, scabbing, blistering, which resolve within a few days after the procedure. How does it feel? So the treatment is usually absolutely painless. Clients often fall asleep during the procedure since it is so comfortable on areas closer to the bone, like above the knee or around the arms, like the Velashape. There may be a slight hot sensation, but it cannot really be described as pain in these areas. What should you do to prepare for the treatment? So no numbing is needed since the pain is minimal. You want to avoid blood thinners, just like aspirin or NSAIDs, for 2 to 3 days prior to the procedure to minimize the chances of bruising. We recommend hydration prior to the treatment with lots of water, at least half your body weight in ounces. What can you do after the treatment to maximize results? You can continue with a good amount of hydration. You want to eat a healthy diet, one that is low in saturated fats. You want to avoid alcohol for at least 3 days post-treatment to allow for the rapid clearing of the fat and toxins. Moderate exercise is recommended, again, to increase lymphatic drainage, just the same directions as the Velashape. But what else can you do to achieve even better results? So you can always add the Velashape to the Ultrashape and vice versa to get the best results possible. So we call this the Ultra Vela combination. This combination will help with permanent fat reduction as well as tightening of the loose skin, which can occur with the reduction of the fat. It will also reduce cellulite and increase the amount of inches lost per area. What unique modalities can you use in our clinic to see better results and aid in the clearance of fat from your body? So pre-treatment, you may want to schedule an IV vitamin C drip for hydration and immune boosting. Post-treatment, we recommend that you take milk thistle or have a lymphatic drainage massage by our massage therapist here, or we have a turbosonic machine that you can stand on, and it kind of helps to better eliminate the toxins and help with the lymphatic drainage. Liver flushes prior to and after the treatment are also recommended. With a combination of the modalities that we have here, you're bound to get the best results possible. Thank you so much for tuning into my talk about the Ultrashape and the Velashape. If you have any questions, please go ahead and ask them, and I will be happy to answer them for you.